Same day restoration is basically what you're looking at in that side of things. If you're talking about, say, making a crown or a veneer or even a bridge in that sort of way, basically you come in for a longer appointment. It's usually 2.5 to 3 hours long. You actually prepare the tooth and the tooth is then actually scanned, or what we use here is a plan scan or an E4D machine. The scanner itself is basically a camera. It actually allows a 3D model to be generated by the computer, and then the restoration can be designed directly on the computer itself. Now that restoration is then sent wirelessly to the mill, which is in-house, but it's at a different area of the surgery itself. And out of a block of porcelain or Emax, depending on which material you wish to use, the actual restoration is milled out, it's tried in, any sort of adjustments made, and then it's actually cured and just characterized to make it look exactly the way you want it to look before it's actually cemented in. Same day restorations, the main benefits of them are the obvious ones, as a matter of fact. It saves you time. First of all, you're prepping the teeth, you're finishing the restoration on that day. So instead of previously in the past having to come in for a 2-hour appointment, first of all, having the preparation done, impressions taken, and those being sent to a lab to be constructed, you still had to walk away both with a temporary restoration in place, and you had to make another appointment some 2 weeks later. So basically, the convenience is that instead of taking a second day of work or making a second appointment, driving in a second time, wearing what is, for the most part, a fairly uncomfortable temporary restoration is another benefit. So you don't have to wear the temporaries that tend to break, tend to fall off, tend to need a bit of extra work to them to make them comfortable. Instead, you're simply actually getting the final restoration on the day and you're done. I actually use the E4D for most crown and bridge work. Now, certainly in cases of heavy bruxes, which is people who tend to grind their teeth quite heavily and have a very strong bite, if they require a stronger material to be used, that might be a case where it might be best. You can still scan it with the E4D, but to have a lab actually fabricate the restoration out of monolithic zirconia or something like that, that actually allows a greater amount of strength to be actually employed. So things like multi-unit implant work and things like that, I do tend to actually have that sent away to a lab to be constructed. And although I think coming fairly soon, we do have the ability to make it, it will be still a bit of a learning curve. So I think that sort of restoration would still be actually done via a lab itself.